The activating stimulus may be something like any kind of somatic sensation or some kind of psychological sensation can be the trigger. And so it could be something like pain in the chest, or it can be a feeling of faintness, or a feeling of depersonalization, anything that seems to be a little bit strange or worrisome to the patient, and it will vary from person to person. Now, what happens next is that a particular belief gets activated, and a belief may very well be something such as faintness could be a sign of having a stroke, or it could be a sign of having a heart attack. And so the patient then gets the belief, oh, I could be having a heart attack, or I could be having a stroke, or I could be dying from this. And the patients actually do feel as though they are dying, as though they are actually having a heart attack. So the imagination starts to play a role in this. And a lot of these patients actually have images of these things happening to them. Had patients who even would have the image of themselves having the heart attack and ending up in a coffin, and they quickly get that image. And so you get the stimulus, you get your belief, which gives the meaning, and the meaning then can come out in an imaginal, pictorial form and just in a verbal form. And then the important thing is the focus. So the attention that gets focused on the stimulus, and the more it gets focused on the stimulus, the worse it gets. The more they think of the faint, the worse they feel. And then the consequence of that is that they then will run to the emergency room, or they'll call somebody and get reassurance that this isn't happening. Now, through something that the learning theorists call reinforcement, positive reinforcement, as long as the patients go for reassurance, it tends to keep the cycle going. And so the consequence itself, then, the reinforcement or the reassurance that they get, tends to prevent them from working through the reality. Now, so the therapy then follows very logically from this little paradigm. So let's just say we get the stimulus of the activation, might be a pain in the chest, say. And of course, you do want to get medical clearance if you're actually working with such patients. But and most of the time, the pain in the chest may be simply just in the rib cage, and you can reproduce this little pain in the chest. As people get these little pains lots of times, but they're not aware of it unless they're hypersensitive, hypervigilant. So you can reproduce the pain sometimes by just pressing on the chest. And so you give the patients a different explanation for what's going on. The people who feel faint may have something that's called postural hypotension, which means their blood pressure drops. And you can get them to stop the faint feeling by squeezing a rubber ball, say. And it isn't just getting the, it's not just a question of getting this thing to stop. It's trying to disconfirm this belief that they have. So you disconfirm the belief through cognitive restructuring. Now, another thing is I say they focus on the symptom. So another technique to use is to teach them to focus on something